Hey, it's my pleasure to have my guest today, Dr. Toby Cosgrove from the Cleveland Clinic in Cleveland, because you have to differentiate, because we have a Cleveland Clinic here at the Ruvos Center in Las Vegas for brain, Parkinson's, MS, and Alzheimer's. What is you're like CEO of the Cleveland Clinic?
I'm the CEO and president of the Cleveland Clinic.
Now, when I talk to people about the Cleveland Clinic, I often talk about that if you had to create a hospital from scratch, that you would come up with essentially the Cleveland Clinic. And some of the things that I observe as a patient and somebody on the outside that make the Cleveland Clinic so great is, like, for instance, your doctors there have a one-year contract. Mm-hmm. How does that work, and why does it work?
Well, first of all, we're very unusual in how we're organized. We're a group practice that has facilities, and we're now 3,000 strong across the world. We all are employed. We have straight salaries, so there's no incentive to do more or to do less. So if I tell you you need an operation, it doesn't make any financial difference to me whether I do it or not. So it's just that I think you need it. The next thing is that we have one-year contracts, and I've had 38 of them now.
You have a one-year contract as well?
Absolutely.
Okay.
And on top of that, we all have annual professional reviews. And as far as I know, we're the only hospital that has that sort of thing. There's no tenure there, and if someone isn't performing, they don't get renewed.
Now, typically, for instance, in Las Vegas, doctors have privileges at different hospitals, right, and they have basically their own practices, and they travel to different hospitals. And but the Cleveland Clinic's model is entirely different. Do you see this model gaining around the country in the future?
What's interesting about what's happening is that now you see more and more physicians are salaried and employed by hospitals. So that's close to where we are. And now 60% of physicians are employed. So it's a model that is like us. It's a little different, however, because, essentially we are the owners as a group. We are the owners of the facilities. And so it has a little bit more personal feeling of responsibility of the whole organization.
In your background, you're a cardiovascular surgeon.
Yeah, I'm a recovering heart surgeon.
But I mean, the Cleveland Clinic has such a huge history with heart surgery.
Yeah.
How did that all begin?
Well, it's interesting. It's almost 50 years ago now that a gentleman a cardiologist by the name of Mason Sones, actually by accident, stuck a catheter in one of the coronary arteries and shot dye into it, and he lit up the whole artery, so you could. And he recognized that he had discovered something important that day. So he went back and did it over and over again. And that was what defined what caused a heart attack. Because up until that time, nobody knew that it was the blocks on the artery that caused the heart attack. So fast forward now, they realized that they had blocks in the arteries, and they were trying to do something surgically for it. And so over a course of years, they kept trying to do patches on the arteries, etc. And eventually they did the aortic coronary bypass graft, which is now known as bypass surgery. And that was in 1967. And by 1970, they did 1,000, and then the whole world was beating a path to our door, first to learn how to do the coronary bypass surgery and to learn how to do the coronary angiograms. And then heart surgery has just continued to grow over time. So we do about 4,500 heart operations annually now, the biggest in the country by a factor of about 2.
And I've had heart surgery there, so I've experienced it firsthand. And everything kind of works as a team there. And I've noticed, because my daughter has been a patient there in the gastro department for inflammatory bowel disease, and everything works as a team there. In other words, they have a colon rectal surgeon, they have a gastroenterologist, they have a nutritionist. So is that a staple of a concept for the Cleveland Clinic?
Yeah, we think that healthcare has gone from being an individual sport to being a team sport. And the thing that really drove that was the fact that healthcare information has exploded. The total amount of information is doubling every 2 years. And no one can take all that in and have all the answers, so we work as a team. And so you'll see that we're organized around a team around particular diseases. For example, when you were in the cardiac program, you had a cardiologist and a cardiac surgeon and a cardiac anesthesiologist and intensive care nurses and all that, all in one team, in one location, led by one individual.
Right, because oftentimes it's not only just a surgery, it's the aftercare.
Absolutely.
That is important. And Cleveland Clinic, in my opinion, just excels in that. you've kind of spread out your tentacles. You have a campus in Florida. We have the campus I referred to here in Las Vegas. You have one in Toronto, and now you're opening up one in the Middle East.
Right. Actually, this is a very interesting project, and it started a number of years ago, actually at 9/11. And then what happened is, because we had a long history of operating on people from the Middle East, because we'd operated on the King of Saudi Arabia's heart twice, and so we had lots of people coming from the Middle East. And all of a sudden at 9/11, it went from about 35 heart operations a month to 5 in about 2 weeks' time. So we thought, well, we serve these people, we might go and look at a hospital in London. So we tried to find a hospital in London. We looked at buying one and leasing one and doing a greenfield. In the meantime, word got out that the Cleveland Clinic was interested in doing something internationally, and we had inquiries from probably 70 countries. The most intriguing one came from Abu Dhabi, and essentially they said, look, we want to build something there. We want the Cleveland Clinic model. Here's a blank piece of paper to design it. We will fund it, and we will pay you a consulting and management fee. And now the keys to this, it's been now 8 years in the process. The keys to the building were turned over to us last week. We now have to load the building. 45,000 pieces of medical equipment, 45,000 pieces of furniture. We are bringing in 3,000 Cleveland Clinic caregivers from all over the world, and we have to house them, and train them, feed them, and get this whole thing up to speed. And so we'll open up there about in January. So it's a huge project.
And this is no different than when you walk around the Cleveland Clinic in Cleveland. It looks like the United Nations of the world. I mean, it's every nationality, every ethnicity is there. Patients, doctors, and everybody gets along. Maybe you got a paradigm for
Actually, I think you make a very good point there, because one of the things that I've had interesting discussions with members of the State Department and ambassadors, et cetera, and suggested to them that one of the very powerful diplomatic tools is healthcare. No one gets upset with you if you're taking care of them and trying to alleviate their disease or their suffering. And so it's a great diplomatic tool for the United States, and at its very best, the United States by far has the best health care in the world.
And particularly the Cleveland Clinic that was mentioned twice during the presidential debates with President Obama and Mitt Romney. Both mentioned the Cleveland Clinic as the paradigm for how health care should be in the United States.
I'm certainly glad that those two could agree on something.
Well, you must have been very proud of that.
Well, we were delighted,
Yeah.
obviously, to have that.
And one of the things about the Affordable Care Act is that it's requiring the computerization of all the medical records. Now, you've had that for a number of years with the MyChart, right?
Yeah, 8 years we've been at this now, and one of the nice advantages of having everything on electronic medical record is we can share that information with the patient. And so we signed everybody up so that they can have access to their chart, password protected over the internet. And so you get your lab studies, your x-rays, your doctor's opinion,
prescriptions.
Notes. Yeah, all that.
Refills.
And you can get it on your cell phone as well. And interestingly, about 60% of the time people go to their cell phones.
And just pull up your medical report. I mean, it's really very
actually, it's your chart.
Right.
And you ought to be able to have it.
Right. But it's been hidden. The medical profession seems to hide this over the years.
No, I think that's a very good point. We think that transparency is absolutely essential. So we've opened the hospital, and you can come and see your loved one anytime you want. The chart is there for you to look at, whether it's in paper form or it's electronic, anytime you want. We're transparent about our results. We publish our results and make them very available to whoever wants them. We think, that we are an entity that is responsible to the public, and we ought to be responsible in putting out there our outcomes.
Right, that's true. And when you're good, you have nothing to hide. I wanted to ask you about the Lou Ruvo Center for Brain Health here at the Cleveland Clinic in Las Vegas. I mean, that was kind of a risky step, I think, to create a center that specializes in Parkinson's and MS and Alzheimer's in Las Vegas. What went into that decision?
Well, it turns out that about a year and a half or 2 years before I met Larry, we had decided to put an emphasis on Alzheimer's because it is becoming such a big problem in the United States. As people live longer, they're not dying of a heart attack when they're 50 years old playing squash anymore. They're living into their 70s and 80s and beyond, and the incidence of Alzheimer's is going right up. In fact, it's now the 7th leading cause of death in the United States. And so we thought we needed to really put emphasis on it. And I was coming out here on another mission at that point, and they put on my schedule at 6:30 in the morning, you're going to go see a brain center. And I kind of got up and I looked at this and I said, okay. So we drive up and I look at this building. I said, my gosh, it's a Frank Gehry building. Yeah. And when I went in and I started to talk to Larry, and Larry we started finishing each other's sentences, because we're both feeling the same way about Alzheimer's and what we needed to do about that. And it turns out at the time that Larry was looking for physicians to run this magnificent building. And after about an hour of talking, we shook hands in the parking lot, and I said, you got a deal. And 2 months later, the paperwork was done, and here we are.
Well, it's been such a win-win.
Well, you know, it's tremendous support that we get from people here in Las Vegas. I mean, it's just unprecedented what you do for us.
Now, you also have this urology center, right, that you're starting, or have started, right? And you're going to grow that? Is that going to have its own
Well, what we
building?
want to do is we want to figure out if we can come into Las Vegas in a bigger way. And that's the first step, and we'll see how that goes. And if it goes well, we'll continue to grow. But, you know, a journey of 1,000 miles starts with a single step.
How do we get you here?
That's right.
Hey, what do our viewers need to do to convince the Cleveland Clinic to open up a full hospital here?
Well, you know, I think that it's about a business, obviously, and you can't do it without patience and support and, you know, people coming to see you and paying you for your activities, and so that's what we're working on.
I'm sure there's some politics involved as well. Thank you so much, Dr. Toby Cosgrove.